Hi, I'm Paula Moore, the chiropractor from posturevideos.com. Today we're going to be looking at your vital lung capacity. In order to measure this, you're going to need a tailor's measuring tape or a piece of string will do. Now, vital lung capacity simply means the ability of our lungs to expand when we breathe. And the more they expand, the more ability they have to draw in more oxygen. Dr. René Kelly, the leading world expert in physical medicine and rehabilitation, tells us that our ability to expand the lungs, in other words, the vital lung capacity, reduces by a shocking 30% with slumped, poor posture. Now, this is crucial because we need oxygen for two purposes in the body. Number one, oxygen converts our food into energy. Without it, we can't move, we're lethargic, our digestion's sluggish, and our organs don't work very well. Number two, oxygen helps to restore old, haggard, aged tissue. So if you want to age well, you need vital lung capacity. That's expensive. So let me show how you test it. Okay, so grab a hold of your measuring tape or piece of string. If you're using string, you're going to simply need to mark on the string the before and after and then hold it up next to a regular ruler. Okay, now mine comes in both centimeters and inches. Can you see that? I'm going to use the centimeter side because they're smaller than inches and I figure you get a better, more accurate result. What you need to do is come right underneath the kind of the breastbone in here, the part where the ribs come under and meet the sternum in here. So you want to go around with your measuring tape. Keep it flat. It's going to go across your shoulder blades and it's going to come right in. And you're going to pinch it tightly on an exhaled breath. So you're going to breathe in, breathe out all the way. When the air's all the way out, you simply squeeze and take a look. And there, for me, is 72 centimeters. So that's my exhaled breath from here to here. Now what I'm going to do is take a few practice breaths, and then on my biggest expansion, I'm going to measure the centimeters of that, and I'm going to subtract the two and see how many centimeters I get. So let's do that again. Wrap the measuring tape back to 72 centimeters. Now hold that loose. Take a few deep breaths just to warm up your lungs a little bit. So I tend to favor going through the nose and out through the mouth. And now let's measure. Great big breath. Ready? Squeeze again, and now I've come to 80 centimeters. So I've gone from 72 centimeters to 80 centimeters, and that's an increase of 8 centimeters. Dr. René Kelly tells us normal or very good lung capacity, really we should be aiming for between an 8 to 10% rise. So from 72 centimeters, a 10% rise would be another 7 centimeters, which would be 79. I had 80 centimeters, so my vital lung capacity is very good. And that's what you should be aiming for as well. It's all right if you're finding you're under that. This is something that can be improved upon. That's why posture is crucial.